Good afternoon, everyone. Welcome to our Friday, May 29th, 2:30 public update. And I'd like to turn it over to IDPH Director, Dr. Ngozi Ezike, for today's medical update. Doctor.
Thank you. Good afternoon, everyone, and again, happy Friday, and happy Phase 3 of Restore Illinois. While some restrictions are lifting, we must still take personal responsibility to continue the reopening, but safely. We must continue to keep our distance and wear face coverings. Just for full explanation, asymptomatic people, that means that people who have no symptoms, no cough, no fever, no difficulty breathing, can still actually have the virus, be infected with COVID-19, and be transmitting that virus unwittingly to others while not having that diagnosis. And that is what I want to explain is meant by asymptomatic transmission. So it's very important to wear our masks all the time, as you don't know who around you could be transmitting. You don't know if you could be transmitting. The virus is still circulating, and we will continue to have transmission and more illnesses, but we do have a role in being able to limit that. Since yesterday, we are reporting 1,622 people newly diagnosed with COVID-19 for a total of 117,455 cases. Sadly, we gotten report of 86 additional fatalities for a total of 5,270 total lives lost amongst Illinoisans. To date, over 850,000 tests have been run, with 21,796 being resulted in the last 24 hours. And regarding our hospital statistics, as of midnight, 3,599 individuals were hospitalized with COVID-19. Of those 3,599 individuals, 980 were in the ICU and 593 were on ventilators. Our goal, of course, is to watch the hospitalization numbers go down as well. We want them to continue trending down, and one important way that we can help do this is through contact tracing. This helps us identify anyone who may have been infected by someone who was confirmed to have COVID-19. Contact tracing is ramping up. Our coordinated statewide tracing program will become familiar to all of you in short order, but I want to let you know the importance of talking with the people who will be doing the contact tracing. You may get a call or a text informing you that you have been in contact with someone confirmed to have COVID-19. Maybe at an initial hearing, you might think, is this a hoax? Is this spam if you got this text or this call? But it's very important that you talk with this person who reaches out to you, the contact tracer. They will let you know what you need to do and can answer your questions. There is no question contact tracing plays a vital role in helping to stop the spread of COVID-19. But there will be scammers pretending to be contact tracers and potentially trying to take advantage of how this process works. Please know that no contact tracers would be asking you for any money, asking for social security numbers or bank account numbers or credit card numbers. Please know that if any requests for that are associated with contact tracing, that is in fact a scam. Please share this information with people you know so that we can help contact tracers, the real ones, get the information that they need so that we can prevent more cases of COVID-19. But also we need to be vigilant and watch out for these scammers who unfortunately are on the prey and looking to take advantage of people. Contact tracing is just another part of our new normal. We must learn to coexist with COVID, and will continue coexisting until we find proven treatments and a vaccine. Please be safe as we head into this weekend, into Phase 3. I trust all of you in your communities will model safe practices. those practices of social distancing and wearing face coverings to minimize the transmission of this virus. Thank you for your continued cooperation. You are the reason that we are cycling into phase 3 now, and with your continued cooperation and vigilance, we will also cycle into phase 4 and beyond. Thank you for your attention. And with that, I will repeat comments in Spanish. Buenas tardes y feliz viernes a todos y bienvenidos a fase 3 de Restore Illinois. Yo estoy muy emocionada de volver a hacer ejercicios, particularmente el tenis, pero voy a continuar con distanciamiento físico. Si se están levantando algunas restricciones, pero debemos asumir la responsabilidad personal de reabrir en manera segura al mantener nuestra distancia y usar una máscara para la cara. Recuerde que se puede tener el virus sin tener tos, sin tener fiebre. Sin embargo, puede transmitir el virus a otras personas. Recuerdan, el virus sigue circulando y seguimos viendo más casos. Desde ayer estamos reportando 1,622 personas recién diagnosticadas con COVID-19 para un total de 117,455 casos. Desafortunadamente, eso incluye 86 muertes adicionales para un total de 5,270 vidas perdidas. 21,796 pruebas hechas fueron reportadas en las últimas 24 horas. Hasta anoche se informó que 3,599 personas en Illinois fueron hospitalizadas con COVID-19. De ellos, 980 pacientes estaban en la unidad de cuidados intensivos y 593 pacientes estaban en ventiladores. Nuestro objetivo es reducir y eliminar la cantidad de personas que necesitan ser hospitalizadas con COVID-19. Una forma de hacerlo es a través del rastreo de contactos, que nos ayuda a identificar a cualquier persona que podría ser infectado por alguien recientemente confirmado con COVID-19. Tendremos más información en los próximos días y semanas sobre cómo será el rastreo de contactos en Illinois, pero quiero que las personas sepan la importancia de hablar con las personas que conductan el rastreo de contactos. Es posible que recibas una llamada o un mensaje de texto por su teléfono informando que podrías estar en contacto con alguien confirmado con el COVID-19. Algunas personas pueden suponer que este mensaje de texto o la llamada no son importantes, pero sí son muy importantes que hable con la persona que se comunica con usted, el rastreador de contactos. Le informarán lo que necesito hacer y podrán responder a sus preguntas. No hay duda, el rastreo de contactos juega un parte vital para ayudar a detener la propagación de COVID-19. Pero también puede haber impostores que dicen que son rastreadores de contactos y se aprovechan de cómo funciona el proceso. Quiero informarle ahora que esas personas no le pedirán dinero o información como su número de seguro social, cuenta de banco o tarjeta de crédito. Cualquiera que lo pide es un impostor. Comparta esta información con las personas que conocen para que podamos ayudar a los rastreadores de contactos a obtener la información que necesitan para evitar más casos de COVID-19. Debemos aprender a coexistir con este virus hasta que podamos encontrar un tratamiento o una vacuna. Estén seguras mientras nos dirigimos al fin de semana y a la fase 3. Muchísimas gracias y tengo un buen fin de semana. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. Thank you for being here with me every day. during this difficult time for our state. I really applaud the amazing work that you've done communicating with people in Illinois about this very, very challenging infection and virus. Illinois, today you have officially entered the next phase of our path forward. And as of today, thousands of our small businesses in nearly every municipality around the state are opening their doors again safely. That includes restaurants and bars for outdoor dining, retail offices, child care services, service counters, personal care businesses, manufacturing, some health and fitness centers, offices, youth sports, campgrounds, outdoor recreation operations, youth summer programs, and tennis facilities. And as of today, all of our state parks are open. Golf courses can allow expanded use, and tracks can restore business with harness and horse racing operations. And as of today, people can gather or camp or boat in groups of 10 or fewer, though, again, the safest choice of all, especially for our most vulnerable population, is to stay at home. Today, I'll be signing a new executive order that reflects the changes under Phase 3 of Restore Illinois. Because Illinoisans have succeeded in moving beyond staying home as our primary goal, this brings to an end Illinois' stay-at-home executive order. The success of the last phase is evidenced by the declining positivity rate, the declining hospitalizations, the declining ICU bed use, and declining number of deaths. As we end that phase, it's important to take note that the people of Illinois have taken this seriously, and that has made all the difference. In this new phase, the new executive order, called the Community Recovery Order, reflects our new, more open reality. But for public health purposes, it still requires limits of groups of 10 or fewer for all groups, and continuing other mitigation practices, such as maintaining social distance and wearing a face covering in public by all who are able. In addition to the extension of necessary legal mechanisms, like our disaster proclamation, the state and national economy demand that we take action to protect people as best we can from the financial challenges that COVID-19 has brought on. So I'll also be extending our ban on residential evictions, moratorium on utility shutoffs, and suspension on repossession of vehicles. We will also continue offering the ability to conduct marriages and notarizations remotely, as well as the suspension of many in-person licensing and training requirements for the time being to ensure that workers can keep their professional credentials active. The significant personal pain that Illinoisans are feeling from this pandemic does not end with our stay-at-home order. Indeed, it's more important than ever to support our working families as we begin our safe recovery. The journey to this point has seemed very long, and unfortunately, the journey is far from over. Let's be clear on this. The virus is still out there, and it is still very dangerous. But here's what's different. In March, we became the second state in the nation to put a stay-at-home order in effect in order to reduce the potential for exponential spread and unimaginable suffering, and to prevent our hospitals from becoming overwhelmed and unable to comfort and treat COVID-positive patients and those with other emergencies. And over many weeks, we did just that. Not me and not Dr. Ezike, all of you. Millions of Illinoisans doing the right thing for their communities, choosing to be all in for your neighbors and your family and your friends. I know there's a whole lot of noise and bad news out there, so let me tell you a little bit of good news about what Illinois has done. As a state, we're averaging nearly 250 fewer COVID-19 patients in intensive care each day than we were 4 weeks ago, a 20% decrease. We're also averaging nearly 40 fewer COVID-19 related deaths per day than we were just 2 weeks ago, a 32% decrease. The president puts out a lot of tweets encouraging reopening before experts say that we should, but the White House guidelines on reopening, developed by Dr. Fauci and the CDC, are actually really specific and data-driven, focusing on positive tests per capita and positivity rates, overall testing rates, hospitalizations, and ICU availability, the same metrics that we track here in Illinois. Well, earlier this week, Illinois became the first state in the nation to meet the White House guidelines to move to the next phase of reopening, the first in the nation. The path to this point has been tremendously difficult, no doubt. And we have lost over 5,000 of our fellow Illinoisans to this virus. It's a harrowing number, and it's just over a few months. Many of our residents have lost someone they love, a family member, a friend, to this virus. I have too. If you're someone who doesn't know a single person who has died because of COVID-19 or been hospitalized because of COVID-19, well, that doesn't mean that pain isn't real for another mother, another child, another friend. I hope you will take at least a moment to grieve for their loss. As we take our next step forward, and especially as we begin to safely reopen meaningful swaths of our economy, we have to continue to look out for each other. Our number one priority must be the health and safety of workers and families and all of our state's residents. Finally, let me address this platform from which I'm speaking today. 82 days ago, we held our first of these daily briefings. And aside from the last few weekends, we've joined together every afternoon for a public update on our COVID-19 response every day since. Keeping the public informed and our operations transparent has been our top priority over the last 2.5 months, and it's been throughout my administration. And on that front, nothing's going to change. But as the state moves into phase 3 of our Restore Illinois plan, our daily update will be replaced by briefings specifically dedicated to COVID-19 only on an as-needed basis. That will start on Monday. Instead, we'll be bringing back some of our more traditional public events. I'll continue to make myself available to the press as often as possible, and of course, COVID-19 questions are welcome at briefings no matter the topic at hand. Additionally, IDPH will continue to send out our daily COVID-19 press releases, and our Restore Illinois regional metrics will continue updating every 24 hours so that the public can track our progress online. And you can find the latest status of your region as we move through phase 3 at dph.illinois.gov/restore. So thank you, and happy to take any questions from members of the media. Elizabeth?
Good afternoon.
Good
so
afternoon.
Good to see you in person.
Good to see you.
Dr. Ezike. I feel honored to be the last pool reporter for the daily briefings.
You are. Congratulations.
Thank you very much. And congratulations to them. So the mayor today had a fairly poignant message to President Trump, specifically 2 very specific words. Just curious if you two have a message for the president following his tweets concerning Minneapolis, your thoughts on Minneapolis, the devastation that's happened there, and the arrest today of the officer.
Well, I have a lot I'd like to say, but let me begin by saying that from the very moment that I announced my decision to run for governor 3+ years ago, I said that this president was a racist, a misogynist, a homophobe, a xenophobe, and I was right then and I'm right now. His tweets, his reaction, his failure to address the racism that exists in America, his stoking of the flames in sometimes subtle and sometimes not so subtle ways is completely unacceptable. It's reprehensible, in fact. And I'm outraged by what he does in response to these situations. I mean, this is, I cannot imagine the rage and the fear that must be felt by a Black American watching what happened to George Floyd. The threat that comes to every Black American under color of law that they see in a video like that. We're lucky that that video was ever taken, because that is happening around America probably every day. And unfortunately, time and time again, even when these videos come out, even when so many of us have the feeling of it's time for a major change, and we work toward that change, somehow for Black America it never really comes. And that's unacceptable. And to me, the progress that should have been made has failed. So we have so much that we need to accomplish in this country, but especially we need to address the underlying racism that clearly exists. And I will be a bulwark of change. I am somebody who believes to my core that we must change. And I want to send my condolences to the family of George Floyd and also to every African American in this country.
This question comes from Eric Hong, ABC7, and Kelly Bauer of Block Club. Churches declaring a big victory today after weeks of you being strong about a number of people not being allowed into churches. Why did you lift restrictions? Did you cave? And why are you backing down from prohibiting in-person services at places of worship?
Well, actually, as you know, from the very beginning, I have said that the most important thing that houses of worship can do and faith leaders can do is to keep their parishioners safe. And that's why we put out guidelines, even in phase 3, recommending to people that they have services that are either online or drive-up services or in groups of 10 or less, because that's the safety guidelines that have been recommended by the experts. And all along, I have followed that science, those recommendations, and I would recommend that every faith leader do that. I've also said from the very beginning that I would never do anything to go break up a service, to interfere with religion. What I have done is implored leaders to not gather their parishioners, because what we want most of all is for people to be healthy and safe.
Were those new guidelines in the pipeline, or was it in response to that lawsuit?
Oh, no, we've always, as you know, I've talked from this podium about those guidelines, but we had never put out kind of business by business guidelines before. But in phase 3, we did that industry by industry, and including outdoor activities, things that aren't really industries, and of course for religious activity. And no, I mean, if it were, it wouldn't be as comprehensive as it was if it was something that was just done on the fly.
Okay. This question comes from NBC5 reporter Chris Coffey. We have heard from viewers who are seeking clarification on phase 3 rules regarding swimming pools at private facilities and fitness clubs. Is one-on-one instruction in pools allowed? What about lap swimming? And what message would you give to swim teams who are awaiting information about pool access?
There's so many details of so many different kinds of activities that are allowed in phase 3 that I couldn't stand here and answer every question about each one of those. But I would recommend there is a hotline that you can call at the Department of Commerce and Economic Opportunity. There's also online, all of the guidelines are available. You can look at outdoor activities. There are guidelines related to day camps and other organized activities, and I would recommend that they go online to see that or call the hotline.
Greg Bishop, centersquare.com. You keep saying the state government has been hollowed out. If that's the case, why is Illinois continuing to spend more year after year with plans to have level spending based on borrowing if there's been a hollowing out?
Well, I don't know if Greg has noticed, but if you look at the number of people who have worked at the Department of Public Health or the number of people who work at the Illinois Department of Employment Security, or go, one after another, each of the agencies of government, and you'll find that there are many more authorized employees than there are actual employees, and many fewer authorized employees than there were in prior years. So the hollowing out, just look at the numbers of people working in state government. As you know, Illinois has the fewest number of state employees per capita of any state in the United States. And so talk about hollowing out. Look what happened 2 years in a row with no budget in this state. That's what hollowed out our state government.
Okay. John O'Connor with the AP. What has your polling during May indicated about voter support for your COVID-19 response and your stay-at-home orders? How did it change from polling results back in April?
Well, I don't think it's our polling results. I've read polling results. I can say honestly that it's clear that people supported the stay-at-home order, that people are deeply concerned to make sure that their fellow Illinoisans are kept safe and healthy, and that people support what we've done to keep people safe in Illinois.
Okay. Sorry, I still have questions coming into my email. Dave Dahl.
May I say one other thing? It is actually gratifying in a way just to know you've seen how Illinoisans have stepped up during the stay-at-home order. Look at what's happened to the numbers, and it's because of them. And I think those polls are something of a reflection, or at least the numbers as they've dropped are a reflection of what those polls tell you, which is an overwhelming number of people in Illinois understand why we've had to react as we have to COVID-19, and they're the ones who, their poll numbers, the people of Illinois, their poll numbers are the ones I think we ought to point to. They're the ones who've done this for us.
Okay. Dave Dahl asks, what plans do you have for acting on the bills the legislature sent you, including whether there will be any big ceremonies for them?
Oh, I don't think there are any big ceremonies for anything these days, at least not while we're in phase 3 and have gatherings of 10 or fewer people. But certainly I will be signing. There's a number of pieces of legislation that came through, and I'll be signing those.
Okay. This is from ABC7. According to ABC7 analysis of COVID-19 testing data, Illinois has improved its testing rank every week for the last 2 months to now rank 10th overall per capita and 2nd per capita among large states. What will you do to ensure Illinois maintains this level of testing as the state reopens and more people are exposed to the virus?
Again, we're going to do what we've been doing every week. Those numbers are an indicator of where we've been and where we intend to go. So I just had a meeting earlier today, as I do on a regular basis, with our team that is in charge of building up our testing capacity and our testing supplies, all the things that are required for us to keep building that number up. So it's hard to do, I might add. This is not an easy endeavor because, again, we're competing against everybody else in the nation for a limited amount of supplies, and because we all need to ramp up testing in a massive way. I think we've been more successful than most other states at doing it, and I'll just credit the people who have led that effort for us, and also our common drive and our goal that we set, the mission that we set to make sure that we have testing. But there's so much more to do. I would like to test much, much more than we're doing now, but right now we have to focus it on the most vulnerable populations and do what we can to keep people safe and healthy as they're going back to work. There's no doubt going to be employers who will need to have their employees tested, and we will try to jump on that wherever we need to.
Okay. This is from Tony Arnold, WBEZ. What does the U.S. lose by having President Trump terminate the country's membership in the World Health Organization?
Well, what I'll tell you is the World Health Organization is one of several very important organizations, and that I think all of us have looked for guidance from. The CDC, a national organization here in the United States, is yet another one. But it seems as if President Trump is withdrawing us from the rest of the world, and I think we saw what happens to a nation when you withdraw from the rest of the world, what happens in terms of chaos around the world when the United States is not leading. And unfortunately, that's where President Trump has taken us, to where the United States is not leading where it ought to.
Craig Wall, ABC7. Now that you've lifted the stay-at-home order, do you plan to travel out of state with your family now, perhaps as soon as this weekend?
I don't have a plan to travel outside of the state right now, but I've never said that people couldn't travel outside the state. People have for their jobs. People have, sometimes people live in Wisconsin or in Indiana and they work in Illinois, or vice versa. And there's nothing wrong with traveling to if it was in the last stage, an essential business and job. Now, as things have opened up more, no doubt there'll be even more activity. Again, I would just encourage people to recognize that traveling is a safe thing to do, but making sure that when you go to a state that has fewer restrictions, that you're not, engaged in an activity that epidemiologists are telling us are relatively unsafe and put you at risk of catching COVID-19.
This comes from Will Radio in Champaign-Urbana. Are all local health departments providing housing to people exposed to COVID-19 who need to isolate for 14 days but are unable to do so in their own home? Are local departments receiving any assistance from the state to be able to provide housing to those who need it for the isolation or quarantine period?
We asked every local health department at the very beginning or near the very beginning of this COVID crisis to determine a certain number of housing opportunities for people who needed to isolate. We asked them to do that, and then we as a state provided our own backup for all of that, for thousands of opportunities for people who perhaps they got COVID-19 and need to isolate from their family, but they don't need to be in a hospital, or someone in their home had COVID-19 or was exposed to somebody with COVID-19, they need to isolate, and you need to get out of that isolated apartment or home. So we've had a lot of that all over the state, and the state has put up reasonable resources to get hotel rooms and motel rooms and make them available. Fortunately, in many, in the alternate care facilities and other alternate housing that we create, we didn't need to use much of it, or at least a lot of it, but we were prepared, and we will be prepared as we, think about the problem of could there be a surge in the fall. And so we want to make sure that we're keeping warm, as I like to say, all of those alternate situations that we created.
How long do those alternate care facilities stay up and running?
Well, I think until COVID goes away, we're going to have some degree of alternate housing and alternate care facilities. And again, until you get a very, very good treatment or a vaccine, we don't want to get caught short. And so we're going to do everything we can while also to keep people safe and give them the opportunity to find those housing opportunities, but also, everything we can to avoid the situation of a surge.
Okay. This question comes from NPR Illinois. It's been reported Illinois' contact tracing program is not near where it ought to be at this stage. Can you reiterate what the contact tracing benchmarks are in order for the state to move to the next phases, if there are any? Are there any public information campaigns about contact tracing planned for the coming months?
To the latter part, yes, of course. We want to make sure that people, as it is spinning up all over the state, we want people to understand what contact tracing was. I thought Dr. Ezike had a great message about there are people who are scammers who, on the idea of a contact tracing, they use that to get your credit card information, your Social Security, whatever. No one will ask you for that. You would get a call from someone from contact tracing in your county, typically, and that call would never ask you for that kind of private information. They will provide you with information. That's all they're intended to do, provide you with information about the fact that you've been exposed to somebody and what your options are at that point and how you can get services if you need them. Sorry, the first part of it was how fast, or are we behind?
What are the benchmarks
tracing?
to move? What are the benchmarks
to move forward? Yeah. Well, we've talked about this before. Today, as you know, we're about covering about 30% of the contact tracing that you can, that's of people who are contacts, and we need to get above 60%, and so that we're trying ratably to get there. And again, it's a large endeavor. We have, 97 local health departments that we're coordinating with. They're doing a terrific job, by the way. More than 80 of them are already very active in helping us build up this contact tracing capability. We have grants that are going out to them, allowing them to hire people over the next 2 weeks. Those grants in many places will have been given to them, and so there'll be hiring that's ongoing during the month of June. But to the extent of, what does it require to get us to the next phase, it's building up that contact tracing, and we're doing it now.
And last question, just looking back, I think you said 82 days of these, nearly 82 days of these. looking back, just your emotion to all this, maybe what would have been done differently or something would have been done faster. I know there's lots of things we've talked about that would have, been better had they worked faster. But just how are you feeling right now? I think there's a lot of hope right now on the street, and it's going to be a beautiful weekend, and people are excited to hit the patios. How are you feeling?
Well, I have two minds about giving you an answer to that. I mean, my first is I am happy to. I'm very happy that that people have been so good to each other in the state, and with this enormous challenge, we're all doing exactly what I would hope that we would, and that doesn't really surprise me. I mean, the people of Illinois are some of the most generous, genuinely giving people, so it doesn't surprise me. I also, I can't finish an answer without saying that we have to be careful. Things as they open up also mean that opportunities to catch COVID-19 open up. And so, wearing your face covering, I came here wearing it, I'm standing here without it, but when I step back, I will wear it again. Wearing your face covering in public and other people wearing theirs, it's an enormously important thing to be doing going forward. All of the experts, the true experts, have recognized this, and that's why we put in a face covering requirement when you're in public. Same thing, all the things we've been saying over and over again, I have to keep reminding people, please wash your hands, please be careful, don't gather in large groups, because all those situations, not washing your hands, not wearing a face covering, gathering in large groups, those are the situations in which we get an outbreak, and those are the situations where people go to the hospital, and ultimately some of them die. And we've worked so hard to get where we are. If we can just follow the rules going forward as we're opening up, we can do this safely and keep people healthy. Thank you.
Okay, we'll go to questions from online. Jim Haggerty has a question for Dr. Ezike. Remdesivir continues to be used to treat COVID-19, but little is known about how well it's working. Do you know if it's being considered an effective treatment, and are there any others on the horizon?
Yeah, there are many studies that are ongoing, many investigational drugs that are being studied for remdesivir. Again, it's not that it's necessarily curative, but it was shown in the studies that it decreased the amount of days of hospitalization for hospitalized COVID patients. So that absolutely is a step in the right direction. Again, those were the preliminary results that made it be pushed out as an investigational drug that we can now use. And we've gotten 3 shipments so far. We're going to get another shipment from the federal government next week, and we're looking forward to putting that out. So it has shown in the early studies to decrease the number of days of hospitalization. So that's what we can say that we know about remdesivir, and other drugs are in the pipeline as well.
Shia Politico, state lawmakers passed a bill that would offer Medicaid to undocumented seniors. Do you expect to sign this, and do you foresee expanding it just beyond seniors?
I will sign that bill. I think it's important, especially at this moment in our history, during the middle of this crisis, that we expand health care.
This was addressed earlier, but we'll touch on it again. Mayor Lightfoot was blunt in her criticism of Donald Trump and saying her message to him was F you. You've been outspoken in your criticism of Trump, but in using such a term, has a line been crossed? Isn't it just playing in his sandbox? Your thoughts? That's Rick Pearson at the Tribune.
I'm sorry, is he implying what she said is playing in his sandbox?
Yes.
I don't know. Look, I told you what I think. I'm pretty blunt about this. He's a racist. I'm not sure what else I need to say that's more severe than that. That's precisely everything that I have fought against in my entire life is represented by what he tweets and says and foments.
Jake Griffin at the Daily Herald. There are reports that some testing locations are being scarcely used, such as Rolling Meadows High. What metrics is the state using to determine testing location viability and sustainability?
So we don't get to pick every location, just to be clear. We try very hard to pinpoint, neighborhoods that we'd like to be in, but then you've got to find an actual space to do it in. So in a drive-through circumstance, those are harder to do than in a building, just because of the amount of effort to create facilities. And then when you do it in a building, you've got to get the permission of the people in the building, and you've got to be able to get ingress and egress at the hours that you want, and so on. So, I mean, I would say we're trying very hard to pinpoint the communities that are most vulnerable, make sure that there's testing there, but also to make sure it's available to everyone in the state, because first responders and healthcare workers and people who have compromised immune systems, there isn't an easy way to pinpoint a community that each of those people might live in, and so we just need to have it everywhere.
Rebecca Ansel at Capital News, Illinois. This is a question for both Governor Pritzker and Dr. Ezike. What has COVID-19 taught you about yourself and what it means to lead Illinois?
I'll defer to Dr. Ezike to begin with, unless you'd like me to.
I'm grateful for the support that most of Illinois has shared. I think it's so evident that leading means having an amazing team of people to work together with and collaborate with. And at this level, it's involved working with our various state agencies, working with our local health departments, working with all community-based organizations. So leading just means collaborating. And on this stage, with this COVID pandemic, it's meant collaborating on just the most intense levels, across all bandwidths, up and down all levels. And it's really the more that's done, the more successful we can be. And I think Illinois has just been a shining example of what leadership means in terms of collaboration and working together, and just making sure that everyone can have input to make sure we get the best results. And I think we've done that as the first state to actually meet the White House metrics. I think that's a very laudable goal that we really have to celebrate. And it also involved the people of Illinois being able to trust their leadership and being wanting to follow the direction that we were trying to lead in. So grateful for that opportunity, grateful to have so many amazing partners, grateful to have such great teams, and grateful, very grateful to be under the leadership of this governor who was so supportive of following the science so that we could do the right thing, and so glad that we could show that science works.
There's a question from Rebecca Ansel. Mm-hmm. She always asks the introspective questions. So I don't know whether to appreciate that or not, but I really I recognize the desire to get into people's heads. I'll just say that, look, I don't know exactly how to describe what it's taught me about myself. I will say that it has really tested everyone in state government. It has tested everyone. Think about the workers that needed to come to work because what they do every day, providing services at our veterans' homes or for our developmentally disabled, or providing or helping people file their unemployment claims, or the many people at the Department of Public Health who have worked 24 hours a day. That we have some unbelievably dedicated public servants. And so I don't know what to say as somebody who has not held elective office before becoming governor. But I did have some, great pride in people who work in government, but I don't think I had seen it this up close and in this intense an environment ever before. And I think the people of Illinois should be just so proud, really, of the people who work every day. I'm not talking about the elected officials. I'm talking about Dr. Ezike. I'm talking about the people who are answering the phones, people who are actually one-on-one serving people as part of state government, serving the people of Illinois. They're second to none.
This will be our last question. It's from Ryan at Health News Illinois. Will the new executive order extend your emergency proclamations related to telehealth or civil liability protections for healthcare facilities?
There are aspects of that, yes, that will continue under the emergency, the disaster proclamations, rather. We didn't talk about every aspect of it, I suppose, today, but there is, we're no longer in a stay-at-home order. and there's a lot that has evolved, but much will remain, and we do want to make sure there's a bill that passed on telehealth, which I'm very glad it did, and we began that in our executive order, but any aspect of it that isn't covered by that bill, we would extend.
Okay, thank you, everyone.
Thank you.